started with the recording. Erin, thank you so much again for joining us and sharing your story.
Yes, of course.
Okay, great. So, why don't we just start with how did you know something was wrong?
So the primary symptom that ultimately led me to seeing a doctor was the lower abdominal pain. That was my first symptom, along with blood in my stool and losing my appetite. But the stomach pain just kept persisting, and for a while I was just waiting for it to go away, and then it didn't for like about a month. And then I just remember like telling a lot of my friends and family that um I like was getting more concerned that this was going to be actually a serious problem, and a lot of people were just downplaying it and making it seem like I was being over dramatic. But it just kept persisting and got to a point where I was about to leave for college, and I didn't want to have to deal with any potential medical things, I guess, by myself at school. And so I was like, you know what, we'll just like see a doctor real quick before I leave. So yeah, I didn't think it was going to be like a really big deal, but yeah, I was like, oh, I have a pain. Maybe I should check it out.
And how much time again had passed until you finally decided to go to the doctor?
It was about a month.
A month. Okay. So, describe what happened. You went to your primary care doctor?
Yes. So I went to my primary doctor. Oh, sorry. And he was concerned about the blood in my stool and the pain in my stomach, and wanted to know what was causing that. So he recommended me to a gastroenterologist, and then we immediately just scheduled a colonoscopy.
Okay. And did they mention anything, or they just, how did they describe the situation to you? How did the gastroenterologist talk about it?
Um, sorry. So So the gastroenterologist was pretty nonchalant. It was just like, we're going to get the colonoscopy and see what's causing the problem. And even afterwards, when I was told that I had a tumor, well, he used the term mass, which I think made it still seem like it wasn't going to be that serious, because I feel like the word tumor versus mass, I feel like in my mind has like a different connotation. But even when I was told that, he was like pretty reassuring. It was like, yeah, there's a mass, but like we'll sample it and call you back in a few days with what it was.
How did they know there was a mass?
So in the colonoscopy, um, they put the camera up inside my intestinal tract to take pictures, and the pain in my stomach was due to a mass where my small intestine met my large intestine. And it was about 4 centimeters when they found it. And yeah, that's how they found out, was through the colonoscopy.
Okay, right. So you had that done. They knew there was a mass, and then the next step was scan.
So we planned on meeting back with my gastroenterologist in about a week to discuss what we wanted to do to move forward. And like I said, he was gonna like call in a few days with the results. He said like 2 to 3 days, and we ended up not getting a phone call. So um, I that more so led me to believe that it just wasn't going to be that big of a deal, and it was just going to be like going into the doctor's appointment and like maybe having a surgery or something. But it was that follow-up appointment that I was told that I had cancer from the biopsy.
Okay, so I'm going to look at your timeline to understand this. So just to be very clear, you went to your primary care doctor with those symptoms. They just had you go to the gastroenterologist. My God, I can't say that word. And then it was at that appointment the colonoscopy was done.
Yes.
Okay, and then a week. Oh, I'm sorry. Go ahead.
I did blood work with my primary doctor, and he called later saying that there was abnormalities, but that was already like after the fact of me getting my diagnosis.
Okay, wow, it took that long.
Yeah.
Um, because after your primary care, you went to the next appointment, got the colonoscopy done. How long and then they saw immediately about the mass.
Yeah.
And then how long after that was the next appointment?
It was about a week.
Another week. So 2 weeks had passed until your primary care doctor called about the blood test results?
It was even a few days after I had got my diagnosis. I think it was maybe 3 or 4 days, and they, uh yeah, they just called and were like, "Oh, there's some abnormalities. We might want Erin to come back in." And, at that point, we're like, "Oh, we're already well aware." So, yeah.
Was that a bit, unsettling for you? I don't know what the right, description is, but for that to take so long.
Yeah, I don't know. I think it was just, like, a bit, like not, like, funny, but, like, ironic. They're like, "Oh, like, there's some abnormalities," and, like, we're like, "Yep, we're already well aware that it's cancer, it's a serious problem." So, I guess, yeah, it was frustrating, and I am very grateful that I was able to get that colonoscopy right away, because I feel like if I waited, um, following the timeline of just my primary doctor, it would have taken a lot longer to get a diagnosis.
Right. Okay. So just to be clear, the biopsy that happened at the second appointment with your specialist doctor. Is that right?
Yes.
Can you describe? So the colonoscopy was one day, then a week later they had the biopsy. Can you describe what happened that day?
For the colonoscopy?
No, for the biopsy.
So they did the biopsy of my tumor when they did the colonoscopy. Like, they saw the tumor and then they took a sample of it at that point.
Right.
So
Okay.
then my
And
next appointment was the diagnosis.
oh, gotcha. Okay. So it was a week until you found out the results of the biopsy, essentially.
Yes, correct.
Can you, Erin, just walk us through that day? You go to the doctor. I don't know what they've told you up until that point. You know you're probably going to get results that day.
Mhm.
How did that all go?
So I was running a fever. I remember that day, but I didn't think it had anything to do with what was going wrong with my stomach. I just thought maybe I got sick or something. And um, I don't know. Me and my mom were in the waiting room just joking around. I think we both, I don't know if it was like denial that it could be really serious, but I just went in really not thinking it was going to be that big of a deal. And um, we sat in the room waiting for my doctor, and he just came in, and it was like the first thing out of his mouth was like, "It's cancer." And I could tell he was kind of shocked by it too. And by the way that he prefaced everything after my um, colonoscopy, he was just like reassuring me that like he really didn't think that that was going to be the outcome, especially because I'm like so young, which I feel like is a wrongful assumption that I think a lot of people have, that like cancer doesn't happen to young people. But yeah, I think it was just so much shock. I didn't really react at all. And my mom was in the room, and of course she just immediately starts crying. But um yeah, I just like had no reaction really. I think a lot of that was due to the shock, but I think overwhelmingly I was really uneducated on what that was going to mean for me going forward in terms of treatment. Like, I was still under the impression I was going to be going back to college in like a week and like maybe seeing a doctor. Like, I didn't understand the full scope of everything. So it was really easy, I think, for me to be kind of in denial about it for honestly like quite a while. And it wasn't until I started to see how everyone else reacted to the news that I kind of was like, this might be more serious than I want to admit to myself.
Right, right. It's interesting. You notice other people's reactions and you're like, oh, okay, this is pretty serious. Remind me, how old were you at the time?
I was 19.
19. Wow, really young. And do you remember how the doctor characterized the diagnosis? Did he or she know what it was? Did they say you need more testing?
So they knew that it was cancer. And I'm pretty sure they knew it was non-Hodgkin's, but they weren't sure specifically what kinds of non-Hodgkin's. So they wanted to do another test, which I think was a bone marrow biopsy, I'm uh or they sent it. I know they sent my sample to the hospital that I later went to, Northwestern, because I had decided that right after the diagnosis, that's where I wanted to go. I knew pretty quickly. And So I knew that it was cancer and I knew that it was non-Hodgkin's, but at that point I wasn't sure specifically what time. But the appointment itself was very quick. He just kind of came in and told me I had cancer and like referred me to an oncologist, and that was kind of like the whole appointment.
So, it was you and your mom at the appointment. She's crying. You were in shock.
Mhm.
How did you tell your other family members and loved ones about the diagnosis?
Um, I think because I was in such a state of denial, I was able to be a lot more lighthearted about it and make it seem like not as big of a deal, which I feel like I am kind of grateful for because I feel like when breaking that kind of serious news, me being able to be more like positive about it was it helped them, I think, handle it a lot easier. But yeah, I don't know. I was just really like lighthearted and nonchalant about it because at that point in time still I didn't really understand like how serious it was. And so when I would break the news, I broke it in a way that was like representing how I was feeling about it, if that makes sense.
It does. It does. And so you mentioned a bone marrow biopsy. So after the quick appointment, he tells you the diagnosis. How long after that was it until your next appointment? Like he referred you to an oncologist. Did you think of a second opinion, or did you just go straight with the recommendation?
So I had two oncologists. I had one close to home that was through a different um like facility, I guess, versus the hospital that I went to in the city. But I had an aunt that previously had non-Hodgkin's, and so not non-Hodgkin's, she had lymphoma. And so we just knew that we wanted to go there because she went there. So it was like a second opinion from the team at the hospital facility that was close to home, and then the different facility and team from the other hospital in the city, if that makes sense.
So you had two opinions.
Yeah.
You only saw one oncologist for your actual treatment. Is that right? Or you had both?
I would see one oncologist for my when I would get my treatment in the city, but I would get frequent blood work in between my treatments at my local cancer clinic. And when I would go to that appointment, I would meet with my other oncologist, but they were in communication the whole time.
I see. Okay. So the bone marrow biopsy that you described, when did that happen? Was that when you first met your oncologist?
Um, I'm not, do you have my timeline in front of you? Do you have the date when I first met my oncologist?
Yeah,
Because I
it says July 29th.
29th. Yeah, so it
I see.
was
It was 2 days later, it says on here. Okay.
yeah, so it was pretty quickly. Once I got my diagnosis, it was like kind of 0 to 100 really fast. I met with my oncologist and then I immediately was getting the bone marrow biopsy and the CT and PET scan, I believe.
Yes. Can you actually describe the bone marrow biopsy for people, the experience of it?
So they they put a bunch of lidocaine on my back, so I ended up not feeling it all. It just felt like a lot of pressure, but I think I was no, I think it was just a local anesthetic, but I was given a lot of lidocaine, so it really didn't hurt too bad. I personally didn't look at the needle, but I have heard that it is a pretty large needle, but definitely not something to be too scared of because they do take a lot of precaution to make you as comfortable as you can be.
Okay, that's very reassuring, I'm sure, for people because, it sounds daunting.
Mhm.
And then the scans that you underwent, you did both a PET and CT scan. Can you describe that process for people who are thinking about what it's going to be like for them?
Mhm. So, um, you have to drink a contrast solution before the CT scan, which was honestly, that was just the worst part, like, not even the scan for me just because I didn't really like the taste, but, the scan itself, the machine might look really scary, but the process isn't bad. You just kind of laying in there chilling, just, I was just daydreaming about what I wanted to do later that day and just trying to take my mind off of it. But yeah, it definitely looks a lot scarier than it is. But yeah, you just lay in a machine for a little bit and then you come out. And yeah, I definitely thought it was going to be a lot more complicated looking at the machine than it was in actuality, if that makes sense.
Yeah, I totally makes sense. And I mean, a lot of it is really just staying still and,
Mhm.
as you mentioned, sort of mentally taking yourself away from that, right? From that
Yeah.
place.
Mhm.
Okay. So do you remember how long it took to get the results? I'm trying to look on the timeline here. Um, but some people, it's like, okay, I have cancer, so things should move very quickly. But sometimes, of course, you have to wait, right?
Yes. So I believe that I would get them within like a few days after pretty promptly. Um, at the points of when I would get my scans, it was pretty close to when I would already have a scheduled appointment with my oncologist for them to go over it. Um, so like it would be like right before I would have a treatment or just like a checkup. So I would typically get the results within like 2 to 3 days pretty promptly.
Did you experience what some people call scanxiety? The waiting for the results of each scan?
Um, I don't think I did much during treatment because in the beginning, I already had the knowledge that I had cancer. So I knew that that was going to be present. And then after my um, third round of chemotherapy during that halfway PET scan, I was put into remission. So I don't think I had a moment of being super scared. I feel like I feel it more so now after the fact, being done with everything. Um, just because, you're like given the clear okay and just the thought that you might have to go through all of that again, I think is really scary. But yeah, I don't think I experienced it much during treatment, but definitely a lot now afterwards.
Okay, so we'll definitely go into that later. But if you could describe the results of your PET CT scan, can you, and the bone marrow biopsy? When did you find out the results, and what did your oncologist say?
So I found out the results with my first meeting with my oncologist in the city where I was going to be getting my treatment. And she said at that point that it was the tumor in my stomach. It was behind my right breastplate. Sorry. It was in my neck and as well as in my ovaries. And she said she didn't like to stage um, them just because it is a blood cancer, but she said if she were to stage it, she would stage it as a stage 4.
Did she describe, so with the bone marrow biopsy then, and the stage 4, it indicated that it just had spread to a particular place, um, to the bone marrow, to the bones?
So, from the bone marrow biopsy, I found out that it wasn't in my bones, and then, the other places in my body, that was the only other places that it was, like, primarily located.
Okay, gotcha. So, was there anything else she said to you for that first diagnosis where it was, did Burkitt come into the language already? Diffuse large B cell?
Yes, so she was kind of describing how it was a mix between the 2, which made it kind of irregular and not like a typical kind of non-Hodgkin's that they would see. And so at that point, they weren't sure on the treatment regimen that I was going to get. Um, and I was going to be doing IVF. So they had a bit of time to like figure out exactly what they wanted to do moving forward. And um, she described it to me that the team of oncologists at the hospital were going to be looking at the um I don't know the word. They were gonna be looking at my case, I guess, and, my type of cancer and culminating together what they thought the best plan of action would be moving forward.
Okay, I see. So how long after that did they schedule your first treatment? Or, maybe just describe the next steps for us?
So after I met with my oncologist, they were concerned since I was probably going to be getting a pretty strong chemo regimen that and me being as young as I was for fertility in the future. So they wanted to start IVF prior to me starting treatment, and that started pretty promptly, like within a few days afterwards I started my IVF treatment. And then that lasted for 2 weeks, I wanna say.
That's a very interesting topic, is, of course, the fertility. Did they bring it up or did you bring it up?
Um, so my first oncology appointment ever was with my, um, local one right after I had the CT scan, and that was one of the things she brought up. She brought up, like, wig shops and, she didn't bring up it in the phrasing of fertility of being concerned. She said it more of like, "Oh, we'll probably wanna do an IVF," and I kind of knew what that meant, and, that's definitely a hard thing to hear, I think being that young, because just, like, thinking about kids in general, and for me, like, that was always, like, my biggest fear in life was not being able to have kids, so it was definitely a really hard thing to hear, but I am very grateful that, I was given that opportunity.
Can you describe the IVF process before treatment?
So that consisted of, I want to say about 3 shots every night in my arm, self injection. And then it was every morning, if not every other morning, I would have to go to a fertility clinic and get an ultrasound to see how the progression of my ovaries were growing.
Okay, great. And then it was, and the trigger shot and then
Mhm.
the actual retrieval, right?
Yes.
If you could describe those, that would be great.
So, the trigger shot I did, I believe it was 24 hours or 27 hours before my, egg removal, and right after that, the next morning, I went down to get the, um, procedure to get my eggs removed, and honestly, it's, like, the same as, like, the bone marrow biopsy. I think it seems a lot scarier talking about it than it is in actuality because you are put under for it, and I personally wasn't sore afterwards, so, yeah, same thing, they definitely try to make you as comfortable as you possibly can be for it, and, you do majority of the time with things like that have an anesthetic or are put under, so the procedure itself, I don't think is something to be too scared of or worried that you're going to be uncomfortable or feel any kind of pain.
Okay, and you did need to get a small dose of chemo, it says, right? Can you describe why that happened?
So, in the middle of my IVF, actually during one of my meetings with the fertility team, I was just at that point I was starting to get physically really sick pretty rapidly, and my tumor had actually doubled in size within the matter of like a week. And they could see how sick I was. I was in a wheelchair at that point, like I wasn't even able to walk, and so they were just concerned. They wanted to like stop the growing a little bit, but they didn't want to give me too much chemotherapy to where it would mess with my fertility since the cancer was in my ovaries. And so that landed me in the hospital for, I want to say like 4 or 5 days. And I was given Rituxan. And it's not uncommon for people to have a reaction to Rituxan, but I think in large part due to the tumor in my stomach, and at that point, my stomach was very full of cancerous fluid to where I looked like I was pregnant. I had a really bad reaction to it, and yeah, and, also during that stay, I got my port put in, and then once I was released, I think I did the IVF for, like, 3 or 4 more days, and then I had the procedure, and then immediately after I had the procedure, I was admitted into the hospital to start chemotherapy.
Wow, it's just one right after the other.
Yeah, yeah.
Can you describe the port surgery?
So I actually had my port put in on my 20th birthday. Um, but um, yeah, I think the worst part for me is just always the fasting, not being able to eat. But yeah, definitely a long waiting to get it done. And then when I went to go get the procedure, same thing, I was put under for it. So um, I didn't really feel any pain or discomfort, especially initially after. I think the port site pain or discomfort from the surgery was a few days after all the numbing wore off, and it was just like a little sore. But yeah, I had like a little birthday party in my room with like balloons and family and friends. So that definitely helped with getting my mind off of everything. I didn't think about the surgery too much. But like I said before, I was like kind of in denial about everything for a while. And so I feel like when all of these major events were happening, I just like didn't really see it as a big deal. I was just like, okay, like I have to go get surgery. Like, all right, like I
Just
don't know.
another thing. Yeah.
Yeah, it's still like I still I guess didn't understand at that point still like how serious everything was and like fully like everything that I was going through, if that makes sense.
Yes. Yeah, no, it does. Brings back some of my own memories too.
Yeah.
But it sounds like you handled it really well, the way that you knew how to.
Mhm.
And with the port surgery, by the way, afterwards, was there any discomfort, or did the port work well for you?
The port did work well for me. Yeah. There wasn't any discomfort. I remember that day, and maybe not so much the day after, but I think when I like was home after that admittance was when it was like a little bit tender and sore.
Right. And to explain to people out there unfamiliar with ports, they needed to put it in a certain time before your first chemo, right? Because it needs to heal. And
Yes.
yeah, go ahead.
Oh, sorry. You can go.
No, no, please. It's your story. I'm just trying to prompt it. So what were you going to say?
Um, I I was just gonna say that like my first like dose of like Rituxan, like I got through an IV, and then yeah, like my infusions were gonna last so long. It was important for me to get that port in, so I wasn't harming my veins too much with the chemotherapy.
Yeah, and it sounds like it worked well for you, which is
Mhm.
great. So what was your chemo regimen? If you could describe the length of it, how many different chemo drugs?
Yes, so I had a like a part A and a part B to my regimen. So each time that I would go in, it would switch out from a part A to part B. So in total, I had 3 cycles of each. And the part A would last a little bit longer than the part B. I believe that ran for 5 days. And after I would finish my chemotherapy, they would keep me in the hospital maybe for a day or so on fluids or platelets or blood if necessary, just to make sure that I was fully in a state well enough to leave the hospital and be at home. So part A would typically last like about 5 to 7 days, and then my part B, if I was lucky and all my levels were looking good, I could be out in 4 days. Um, but yeah, the part B would range from about 4 to 5 days. And I, s- s- I believe RCHOP was one of them. And then the other round was the like random other drugs I put in my um, timeline. I'm not sure specifically which ones they were. I can I know I put them down in my information, but if not, I can definitely look that up and relay that information back to you. But
Oh,
um,
no, no worries. Yeah, really more just wondering about the actual process itself. If you could walk through, so, the people who are watching this most likely are either going through the same treatment or
mhm,
about to.
okay.
So, going into part A, if you could just describe, like, did you go to were you inpatient? How long did these infusions last? Just describe all those details.
Okay. So I was admitted into the hospital and I received it inpatient, and my infusions were continuous. So I would be hooked up to my IV for either 5 days at a time with the part A or about 3 days at a time with the part B. Um, and yeah, they would run consistently, and I personally didn't really feel a lot of discomfort or side effects from the chemotherapy itself during treatment. I feel like I felt side effects the few days after finishing it. Um, but yeah, the only thing I really noticed during my treatment was that I would get very, very hungry due to the prednisone, or sometimes would feel kind of nauseous to where I wouldn't want to eat. But in terms of side effects that I felt during the chemotherapy, that was about the only thing.
Okay, so mostly you were hungry.
Yes.
Some, did you say nausea? A little bit of nausea?
Yes. I was on a lot of nausea medication when I was in the hospital, as well as a lot of pain medication kind of on the clock. So I think without that, I would have been a lot more nauseous due to the chemotherapy, or in more pain because of um, just everything in my stomach. But yeah, I was definitely given the medication to where I was able to be pretty comfortable given the situation in my hospital bed.
Okay, great. Okay, so you were saying that you had taken so many anti-nausea medications. Is that sort of the advice to people, is to just try to get out ahead?
Um, yes. I personally would prefer for myself being on nausea medications and pain around the clock, just because um for me personally, when I would feel nauseous, if I were to request nausea medicine after already like feeling the sensation of being nauseous, I would end up just throwing up regardless and probably throwing up my medication. And I kind of had a knowledge from my first round of treatment, I guess, is like a test run, to have the knowledge that I was pretty nauseous from all of it. So yeah, because of that, they definitely kept me on kind of an around the clock nausea medicine, just to like not even have that as a possibility.
Yeah, no, because the goal is just to try and prevent you from feeling everything else
Yeah.
that can come like a tidal wave. So, Erin, the you described the days of the chemo infusions. Um, Being there, can you describe a little bit more in detail about how the days would go? I know, for instance, nurses check in a lot. How were the infusions around the clock?
Yeah, so the infusions were around the clock, and my nurses would come in pretty frequently. Some of the I'm trying to think.
Or another way of even kind of describing it is you would go to the hospital for your first day of infusion.
Mhm.
Can you just talk through that process? So they would do blood tests, and then how long would it take until they finally started you on chemo? And you know what I mean? Like,
Yeah.
yeah.
So I would go to the hospital, and prior to me getting admitted, I would go and get my blood drawn by the staff, and then I would wait to get taken up to my room. And once I got into my hospital room, I would get kind of settled for a while, and it would normally take like a little bit, like a few hours for my chemotherapy to get ready. So I definitely had some settling in time when I would first get there. And um, a lot, sometimes they would like start me off with like some fluids beforehand. But yeah, it would take a few hours for my chemo to start, and then yeah, once I was on it, it was pretty continual until right when I was going to get released for the most part.
Okay. And it would be, again, how many days in the hospital?
So for my part A, my infusions ran for about 5 days at a time, and they wouldn't discharge me until my levels looked adequate enough.
Your blood
So
level, your blood counts?
Yeah, my blood counts and like my potassium and things like that. So even though my infusions would only last 5 days, I would sometimes be in the hospital for 7. Um, and that also could be due to my chemo taking a little bit longer to get started, and so that would push back the timing of everything. So
And
for
what
part
would cause chemo to be delayed?
so, um they would take my, weight and everything when I would get into the hospital, so they would know the correct, dosages for the chemotherapy, and, sometimes, that would, like, fluctuate a little bit, and so there would have to be changes made to my chemo, and just having the, like, pharmacy being able to get it ready, sometimes there was some delays, and so I could get in the process of me getting my room could take a few hours itself, just waiting to get my room, and then also the few hours it might take to get my chemotherapy could push my stay a whole day back, if that makes sense.
Yeah, and I'm glad you're bringing it up because a lot of times I think we don't realize these are all parts of the experience
Yeah.
because the hospital might have limited beds or the pharmacy's not ready.
Yeah. So that could definitely push my stay back a day or 2. And then for the Part B, it normally was a little bit shorter, around, 4 days, 4 or 5 days, but I think that infusion only ran for 3 days in
And
total.
in total, and then you would still though have to stay until your levels were checked out, right? And
Yes. Mhm.
so a lot of people describe, for instance, with this kind of chemo regimen, the first week is all the treatment. Some people, they say the second week is when the side effects really kick in, and the third week would be when you start to have your good week to recharge for chemo again. Does that fit pretty much for you too, or was it a little bit different?
Yes, I agree. Yeah. Yeah, definitely the first round, I was, like, pretty good. I didn't really feel any side effects because I was, like, although I had the chemo the other week before that was, like, such a small and singular dose, I didn't really have any side effects aside from the initial reaction I had to it, from that chemo, but, yeah, the first one, I didn't really have any, side effects except losing my hair, and then my second one was definitely when I felt the most sick, and then after my third, yeah, was when I started to feel physically like I was able to go out and do a lot more things, whereas before I was very much, like, bedridden.
Can you describe that week, the second week? Because you were at home, right? Usually you were at home recovering. How did
Mhm.
you pass the time? And second week and going into your third week?
So the second week of me being do you say second week, like, as in my second chemotherapy or, like
No, the second week, meaning when you're home recovering. Yeah.
okay.
Right,
So
'cause were your cycles actually, let me see here. So, did it so how actually, that's a good question that I didn't ask. Cycles are different lengths, and so, um, mine, for instance, was 3 weeks. So,
mhm,
chemo first week, second week recovery, third week more
okay.
recovery. How
Yeah,
long were your cycles?
yeah, mine was the same way. I was thinking of, like, the second week as, like, my third week, if that makes sense. But yeah, chemotherapy for a week and then the second week recovering. Um, for me, it was definitely a lot of fatigue and a lot of nausea. I found myself just laying in bed or laying on the couch and just watching Netflix or um just trying to find like more like mindless activities like coloring books or something to pass the time. And for me personally, I found being in the hospital and being kind of isolated from people mentally draining. And so I would also, in that first week, feel the need to just like mentally get myself back together, before I could really like fully engage, I guess, with a lot of people like I otherwise would in my daily life. It was a lot of physical recovery as well as a lot of mental recovery.
And at this time, of course, especially when you're first diagnosed, a lot of people have questions, for you. Did you how did you find it? Some people might say it's a little bit exhausting because people ask the same questions, or how did you deal with the influx of concern for you?
My parents were very great advocates for me. So in terms of my family, my parents would kind of advocate for me a lot. And something that I personally noticed was a lot of people would ask my friends how I was doing in a lot of questions. I think some people were a little nervous or didn't know the right ways to ask me personally. My close friends, of course, would ask me about my treatment and stuff, but I feel like in terms of the vast majority of like my community and everybody, a lot of people I think were scared to ask me personally and would ask people like my friends that they knew knowledge about my state.
Okay, great. Thanks for that. So as the cycles went on, how did you feel? Were the side effects getting worse? Were they better because you understood the cycles better?
hmm At the beginning of my treatment, I was overall really physically sick in general, so I was just feeling very just fatigued and just not the best, and so the side effects, um, I was still, like, learning how to manage them, and so that point, it was a little bit challenging, but I think after I had a round under my belt, I had a better understanding of how to manage my, nausea and everything, and I kinda knew how long it was gonna take for me to, fully reboot and get back to a better state, but after my third round of chemotherapy, aside from the first few days of nausea, which for me was my primary like side effect was just a lot of nausea. After that, I was at a pretty good place physically to where I felt pretty good. I don't know if that answered the question. I'm sorry.
No, 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 not at all. And all of this, whatever you're recounting, is really useful. So don't apologize for that. I do want to ask before I forget. One of the greatest concerns when it comes to side effects, of course, of chemo is hair loss. And so, if you could just describe when you started to feel like you were losing your hair and what you decided to do with it.
So it was about a week before I was going to go in for my second round of chemotherapy, and it was in the shower. I saw just some hair falling out, but at that point, it wasn't heavily. It was just like the very beginning stages of it, but it looked like it was a little bit more than normal. And I anticipated that me losing my hair was going to be happening soon. So I kind of understood that that was the beginning of it. And for me, I thought that it would be a lot harder to progressively watch it fall out, especially because I had very long hair at that point. Um, and I found myself like avoiding brushing it for the first few days because I didn't want to see it fall out. And um, it was getting so close to my second um, round of chemotherapy that I didn't want to let it get to a point where I wanted to shave it and have to do that in the hospital because I knew that was going to be a really emotional experience and I wanted to be able to be home and have time to myself to feel all the emotions that come with that. So I ended up just wanting to put it in my own hands and just rip off the Band-Aid. And the first day that I went into the salon and had the intention of shaving my head, I actually did the cancer cut, as a lot of people call it, just like the blunt, short haircut, because I feel like it's a lot easier when your hair is a little bit shorter to lose it versus when it's long, just mentally as well as like physically, like the hair like shedding. Um, and then I had that short hair for about a day, and then I just decided just to shave it all off because although I didn't have control in the situation of losing my hair, at least I felt that that gave me some level of control of taking it in my own hands and shaving my head versus letting cancer let it completely fall out, if that makes sense.
It does. I think it resonates with so many people who've gone through this because, as you said, we don't have control over almost everything. But
Yeah.
shaving it is the step where you feel empowered. Is that a good word?
Yes. Yeah, I feel like although shaving my head was a very difficult thing for me, I feel like in the grand scheme of things, it definitely made me feel a lot more empowered and uh, better about the situation than if I were to had seen it progressively happen. And it for me, since it was a hard experience, sorry.
Oh, Erin, I think the audio somehow is not coming through.
Okay, perfect.
So you were describing the hair situation and how it was hard for you, but
Yeah, so it was a hard experience for me, but I feel like being able to put that aspect of it in my own hands and be able to shave it myself made it a lot easier than I think it would have been. Just kind of like I said, ripping it off like a band-aid versus prolonging it and letting it fall out, which I feel like either option is totally fine. I know a lot of people choose to keep their hair and have it progressively fall out, but for me personally, I just knew that it was going to be a really hard thing for me to deal with, and so I would rather just put it into my own hands.
yeah, thank you for sharing that. And by the way, your hair looks great.
Oh, thank you.
Yeah. So I read that another bit that was really impacting your treatment was needing to have let's see here, the transfusions of blood and platelet. Can you talk about that as well as being neutropenic, right?
Yes. So it wasn't until about my second or third round that I started to need to get blood and platelet transfusions. And I think it was around the same time, I think more so towards my third round of chemotherapy was when after my rounds, I would tend to be neutropenic during that break and have to go back in the hospital and need blood transfusions and platelets. Because I feel like the progression of chemotherapy, it just like progressively gets a little bit more hard on your immune system, if that makes sense. So in the beginning, that wasn't too much of a concern. I feel like my immune system was able to bounce back a lot quicker um, during my times off between my chemotherapy. But yeah, for the last 3 cycles, for the gaps in between, I think for all of them, I definitely needed a blood and platelet transfusion, if not a few. And I would get that fever over 100.4 and have to be put back in the hospital because of being neutropenic. So definitely something that I face a lot more in my half of treatment.
Okay, was having to be hospitalized just to make sure your blood counts were coming back up.
Mhm.
Did they give you the shots like Neulasta or
Yes, so I was given Neulasta right before I would like physically leave the hospital, and I would get blood counts taken twice a week during the 2 week gaps that I wasn't getting chemotherapy. So in total, 4 times before my next chemotherapy, just to monitor all my levels. And from that, we would get good picture of when I would need to get blood or go to the hospital to be neutropenic. But the Neulasta for me personally would kick in about a week after. I noticed definitely more so towards the end of my treatment, it would take a little bit longer for the Neulasta to kick in and spike up my counts, which was the reason why I would have to go in the hospital more for being neutropenic, because I feel like your counts dropping is like inevitable in a way because of the chemotherapy. But Neulasta, I feel like a lot of the time is really good at bouncing it back up right away. But for me, it definitely took a little bit longer for it to kick in.
yeah, and when it did, some people describe bone pain. Did you feel any of that? And if you did you take anything to help with that side effect?
Yes. So I experienced that only for my last 2 rounds, and by the end it it was pretty painful. I think I maybe might have felt it a little bit in the middle of my treatment, but it was more so at the very end. Um, and I believe they recommended Claritin to take, which helped in the beginning when it was minor, but my doctor, my oncologist ended up just prescribing me a painkiller to help with it. Um, but yeah, definitely like same with my counts and everything. I feel like in the beginning, it wasn't very much a problem. It was towards the end of treatment that those kinds of things started to arise more so for me.
Okay, maybe like cumulative effects.
Yeah,
Okay.
exactly.
Um, so there was great news in the middle of your treatment, right? You got your mid-treatment PET CT scan done. Can you describe the process and when you found out the results and what they were?
So for that one, I actually didn't get the results for about a week or so. I had that CT after my um, third round of chemotherapy. And of course, you have to like wait to go over that with your oncologist. Um, and so I waited until I was going to be admitted into my fourth round of chemotherapy. And I was just talking with my oncologist, and she just like kind of brought up like being in remission. And we were like, wait, what? And she's like, oh, nobody told you? And we're like, yeah, no, no one has told us that yet. But yeah, it was, I had a good feeling at that point that the chemo was working and going along with the course, because I was like, as you call it, like your good day, like your good weeks. I started to feel a lot physically better. And so I was like, like I have a good feeling that it's working, but I definitely did not think that I was going to be in remission. It was very much a surprise. And definitely was just such a great surprise, especially to hear right before I was gonna go in for my hospitalization for chemotherapy, because as that progressed, it was a lot harder for me. Just being stuck in the hospital and isolated for a little bit of time, I kind of like didn't look forward to it too much. So I think that definitely lifted my spirits and helped me get through everything.
It gave you a boost.
Yeah.
Yeah, and so did she use the word remission, or did she say there's no evidence of the disease? Do you remember?
She used the term remission.
She did. Wow.
Yeah.
Okay. And then so but she just said you have to continue and finish your regimen, right? Did she describe why?
Yeah, so they quickly said that right after they said that I was in remission. They're like, although this is great news, we still want to finish your chemotherapy regimen. We don't want to stop right there. I think just to make sure and just do that extra layer of precaution, um, which, at that point, I was already like staying at home instead of being at school and stuff. And I figured, I already fought half this battle. Like, what's a few more months, just gotta keep on pushing and get through it. So although it was like a little
So your oncologist said, "It's great news, you're in remission, but we have to finish the regimen because."
they just wanted to have that extra layer of just protection and reassurance that the cancer was completely out of my body. And um yeah, it was just kind of like that whole chemotherapy regimen was like kind of set in stone. And it, regardless of me being in remission in the middle of it or not, was to finish out the full scope of everything. And yeah, I think it was more so just to have that extra layer of protection and just make sure that it was completely out of my body.
And just to be clear, I hadn't asked you this, but the part A, part B, it was because they diagnosed you with two forms of non-Hodgkin's. Is that right? And can you kind of describe that situation for people?
Yes. So I'm not sure if I got the part A and part B, like a part A specifically for the differing types. I think that culmination of a chemotherapy was just due to it being not a um, more regular diagnosis. And so basically, they told me that um, it was like the diffuse large B cell, but it was also like Burkitt in the way that it was very fast growing also. So it had like components of both of the differing kinds. And so I think that's why I had like not I had a more like personalized, I guess, kind of chemotherapy regimen.
Gotcha. Okay. So you went through the whole treatment. You got a final PET CT scan done. And can you talk to us about that and how long it took to get results?
So I had that final CT scan. I was actually in the hospital because I had a infection in my port. Ended up being a staph infection. So about like 3 days after I finished my chemotherapy, I was put back into the hospital, and that those scans weren't I for cancer or seeing if I was in remission. I think it was more so because of the infection that I had with my port. And um, I ended up going to a local hospital and not the hospital that I normally got treatment at, um, just because we were like thinking that I was, um, or let me remember. Um, yeah, we just like went to like a local hospital because we were just concerned because it was getting a little swollen, and then it ended up turning out to be a bigger deal. And so we were in the hospital for about a week, and um, the the staff there, when they gave me my scan, told me that they found another mass, which later turned out just to be poop. Um,
Goodness.
but yeah, but I think like how I said before, when I first was told about my tumor and I was told that it was a mass, the phrase mass made it seem a lot less scary. But I think this time around, hearing the word mass and knowing what mass meant before was very, very scary. I thought that I had relapsed and had another tumor. So that was definitely a scary time. Was definitely happy to find out that it was just poop, and was a little bit frustrated that they phrased it to me in that way, because it's just like a million things pop into your head when you hear that.
Especially in
But
your shoes. Yeah.
yeah, and I was at that point, my mom normally stayed with me in the hospital during those treatments, but since I was closer to home, I just stuck it out by myself. So I was alone when I heard that. So it was definitely yeah, it's definitely scary. But once we ruled out that that was just stool, I did hear the news that I was still in remission and there was still no cancer detected in my body.
So wonderful. I'm so glad to hear that. And I mean, first of all, I've never heard of a staff mistaking a stool for something
Yeah,
cancerous. Yeah.
yeah. I don't know what they were thinking.
Do you remember how long it took to finally clarify that no, what they're seeing is not,
It
cancer?
was, yes, it was, I think the next day. I think in large part that was due to me just already being in the hospital and having the ability for my oncologist to come and see me whenever they got the news, versus if I were to get a scan just in my regular life and having to wait to meet with an oncologist to go over those results, if that makes sense. But I believe it was, yeah, just the next day, if not the day after that. But it was pretty quickly.
Okay, great. And as we wrap that part of it up, is there any last thing that you wish you had known, or, in other words, what you would tell Erin from before at the start, like, hey, you should ask these questions, or heads up, this is what you're gonna, meet, be ready for this, or
Um, I think I would wish I knew more about the mental part of it all, because I feel like universally, like it's going to be a hard thing to go through physically, and I don't think I understood how much it would kind of affect me emotionally, I guess. And I feel like for myself personally, um I feel like you want to be that really positive and strong person all the time and through your treatment, not only for yourself and for others. um and I feel like especially with social media, like it's very easy for people just to post the happy pretty parts, which I'm victim of too, but I would always look at other people going through a similar situation, and it just appeared like they were handling a lot of things better than I was. And um, as much as you want to stay really positive and strong the whole time, there are moments where you aren't. And I wish I knew that that was okay, and that it was valid, because I think I beat myself up a lot because I felt certain ways or reacted certain ways. Because if that makes sense, like I feel like I
Yeah, you put a pressure
wasn't
on
with,
yourself to
yeah.
have to feel okay.
Yeah, I wish I knew that whatever reaction or way I felt about anything during my treatment was justified and
Yeah.
valid, I
Yeah,
think.
absolutely. And so I guess then your message to other people would be that, right? Is to allow yourself to
Mhm.
feel whatever it is you're feeling, you have a right to feel it.
Yeah, yeah. I definitely wish I knew that more so going into everything.
And now you can be helping others who are just starting. Any advice in terms of, well, what helped for you get through the toughest moments? Because as you mentioned, the mental part is very, very
Mhm.
difficult.
Um, I think just leaning on um those you have around you that want to support you. My family was such a support system, and cancer is very much not just a singular battle, but I think a battle with, how do I want to phrase this? It's very much like a group effort. I think going through cancer, it's such an intense experience, that it's really hard to deal with expect yourself just to deal with a lot of that on your own. And so I think just me leaning on other people when I was feeling down, and just having that emotional support from other people, I think helped me a lot in my lowest points. Just turning to like my family or whoever just to boost my spirits, I guess, was definitely what helped me the most.
Yeah, and in addition to just having them to be there to boost and lift your spirits, was there other kinds of support you needed from people? Because sometimes I hear, it's hard for people to ask for help, or from the side of caregivers, it's
Mhm.
hard to know how to support. So, do you have any tips on that?
Tips for like how other people can help,
Yeah,
or
I think for both, right? Both advice to patients for how to ask for support and tips to caregivers, people who love you, on
Mhm.
how to offer or give the help.
I think in that situation, it can be a little hard sometimes, because I feel like it's hard to ask for help, and I also feel like other people on the outside of the situation, they so much want to help, but they don't know in what ways is the best to help you. And so I know for myself personally, I really struggled with asking people for help, because I didn't want to feel like I was, I guess, like a burden. But I think just knowing that people overwhelmingly want to be there for you and help you through this difficult time. So just um, pushing that away, and just I guess just trying to be like really open in what you want help with. And I think in terms of people that want to help you, um, I think just like really showing up and being there for that person, versus just saying things like, oh, just let me know what I can do. Cause I feel like that's just kind of like an easy way out. Just like, oh, like if you need anything, I'm there for you, versus like doing things actively to be there for that person, whether that be um like, I don't know, like helping them like emotionally, or just like running errands, or like grocery shopping if that person isn't able to, get up and do a bunch of things that day. I don't know how I'm trying to. Do you know what I'm
Ask,
trying?
maybe offer something specific, like
Yeah.
offer a
Mhm.
meal that you'll drop off, as opposed to putting it on the cancer patient's plate, right, to figure it out.
Yeah. Yeah. I definitely think it's more appreciated. Um, it's like appreciated the offer to be there whenever they need help. But yeah, I think it's definitely a lot more beneficial just to like do
It
those actions and actively
yeah,
do it rather than just saying it, if that makes
right. Yeah, it does. It does. And so moving forward, I just have two questions. One is, it's a two-parter, but you, after getting that clean scan after your treatment, what was the follow-up protocol?
So I was supposed to, prior to me knowing that I was gonna go back in the hospital and get that scan, the regimen was going to be a follow-up scan every 3 months and a meeting with my oncologist. However, since I did get that PET scan right after my treatment, um, they wanted to push everything back to wait 6 months post treatment to get a follow-up scan. However, I was still going to meet with my oncologist and get blood work every 3 months. But for me personally, with just like anxiety about everything, it's like you come out of treatment and you're so used to like seeing doctors all the time, and then you go from like just being put back into the regular world. I wasn't comfortable with waiting 6 months, so I pushed and advocated a lot for myself to try to get one a little bit sooner. Um, so yeah, but now it's a little shaky. Last meeting I had with my oncologist, they wanted to do a 6 month post scan, and then depending on what that was, um, see from there. So I feel like in terms of my protocol, it's kind of up in the air. I feel like for most people, it is what I was supposed to have, which is, the like 3 months checkup kind of thing. But mine's
Have
just kind
you
of up
Yours
there.
is in the air. Okay,
Yeah.
gotcha. And so it's and making it even a little bit more complicated, of course, is this COVID-19 coronavirus situation. You
Mhm.
said you were supposed to get that 6 month scan done, or that next scan done before,
Today,
but
actually. Yeah. I was supposed to go get my scan today. Initially, for the 6 months, it was supposed to be in June, and I really like advocated for myself. Just to give myself some peace of mind, to get one a little bit sooner. And so that was supposed to be today, actually. And then because of Corona, it got pushed back to next month.
how is that, I guess, being cancer, in remission in the time of coronavirus when you want to get that scan done and you're like being told, no, sorry, gotta hit pause.
Yeah, it definitely is a little frustrating. Like I completely understand, given the situation, but I think just wanting to have that reassurance in general that everything is still okay, and I think especially in a time like this because like things with neutropenia and just cancer in general is already such a scary thing, and adding corona into the mix, it's like I just want to make sure that I am either healthy or if I'm not taking the right precautions in this kind of environment. So,
Yeah,
yeah.
yeah. So have you had to be even more careful, I guess, just recovering?
Yes. So after I went in for when I went in for my 3 month blood work, my blood work wasn't still up to par. So I still had a little bit of lower white blood cell count, which I guess like makes me a bit more susceptible. And I think just because of everything that we went through and it ending so close to when this started, me and my family were already so used to taking so many precautions, and now I feel like especially with this, I feel like everybody should be staying at home, but I feel like some people, uh, I guess, like, don't follow that as much, but for me, for myself, like, that's not even, like, a possibility of, like, thinking to going to the grocery store. I just, like, completely stay at home just because, it is scary, especially going through, like, something like this, being immunocompromised and, just having your health so much at risk. I feel like it gives me a very different outlook on the situation and protecting myself and taking precautionary measures.
Absolutely. My last question is running off of what you had just mentioned about how you advocated for yourself.
Mhm.
Pretty powerful message. So, what would your sort of guidance be to people out there about advocating for themselves in this process?
I think it is so important to advocate for yourself, because at the end of the day, it's your body, it's your life, and you're going to know your body better than anybody else. Um, if I would have just listened to the people around me and haven't pushed, whether that be to see a doctor and ultimately get my diagnosis or push to get this scan, I feel like I prevented a lot of situations that could have had a very different outcomes had I not advocated for myself. And um I just think you know your body better than anybody else. And if you think that there's a problem or if there is something that you're concerned about in terms of your health, you it's your life on the line. I feel like it's very important just to um be very, I guess, like, I don't know the right word. Just like being very convicted in what you want or what you think needs to be done for you because you know yourself better than anybody else.
Thank you so much, Erin, for sharing your story, for spending all this time with us. We really appreciate it.
Yeah, no problem.